She's got 3 joints that we hope will be positively affected by the stem cell treatment.
Dogs are cherished parts of our families, so when we're sick or they become sick, the relationship becomes even more important. Canines can care for us as we care for them. With a wet nose
Want to go for a walk?
and willingness to please, it seems like our dogs live just to make us feel better, even when they don't feel well.
Are you a shy Tootsie? Oh my goodness, she's so shy.
Just ask Tootsie's owner, Nalita Bell.
She is lovable, she is perky.
Perky on the outside, but inside, Tootsie was a very sick pup.
She started making this funny sensation with her bottom lip and her jaw. It would quiver.
Nalita thought it was her teeth. Turns out it was a malignant melanoma in the back of Tootsie's mouth.
I'm a physician assistant. I specialize in oncology. I've been doing that for 26 years. And it never even dawned on me that this could have happened to a dog.
The survival rate is 1 to 5 months, but a new treatment, a canine cancer vaccine, is changing that.
Overall, it's been shown to significantly prolong survival in dogs with oral melanoma.
Studies show dogs that get the vaccine, along with surgery or radiation, have lived 4 times longer.
The point of it is to stimulate their own immune system to recognize tumor cells and then kill those affected cells.
The $4,000 treatment will not cure Tootsie, but prolonging her life serves a greater purpose.
Melanoma in dogs kind of closely mimics the natural course of the disease in people, that maybe once we get more data available in dogs, we could actually transition it to a similar type of vaccine to be available for people.
10-year-old Maggie May is another medical dog on a special mission.
What a good girl.
From the time she was rescued and adopted a year ago, Maggie May's owner knew she needed special care.
She was limping, but we didn't know why. I mean, it could have been an injury per se.
They found out she had arthritis.
Both hips are really bad, and her left front elbow is also really bad.
Maggie's undergoing a special kind of stem cell therapy.
It's not from embryo, and it's not from the bone marrow. They're taken from fat. There's a fairly high concentration or high numbers of stem cells within the fat tissue.
Veterinarians extract fat from Maggie May. The tissue is sent to a lab where stem cells are isolated. Within a few days, those cells are then injected directly into her joints.
We know we're not going to make those tissues normal, but it will suppress inflammation, slow the progression of the degenerative changes.
Who says you can't teach an old dog a new trick? 6 weeks after stem cells, derived from her own fat, were injected into her joints to treat arthritis, Maggie May is better.
Yeah, you want to play, don't you? Yes, you do.
And what we learn could one day provide cures for other animals, too.
It's going to be great benefit to dogs and cats. I mean, pretty much animals in general, any animals that typically are treated for arthritic type problems.
Including the 2-legged type.
This is done in people as well. Of course, it's not as highly publicized as some of the other forms of stem cell therapy. There have been several human clinical trials.
Fat-derived stem cells may one day be used to treat not only arthritis, but to regenerate blood vessels, cardiac muscle, and help people with spinal cord injuries.